Kieran here from Inside Scan, and today's video I'll be looking at the different ethical principles you should be following in medical ethics questions in the run-up to your interviews. For those who don't know me, my name is Akil and I'm a first year medical student from Northern Ireland studying at King's College London Medical School. So today I'll be looking at the pillars of medical ethics for my next video series, and these pillars should be the guiding principles for you to follow at interviews and throughout your career when faced with an ethical scenario. It is important to remember that medicine is a mix between science and a humanity, and a good doctor will need elements of both to be able to provide their patients with the best possible care. So there are 4 pillars of medical ethics and 2 other ethical principles you should be aware about when tackling ethical questions. And I will give a few mock examples in future videos on how to use these principles in practice. So there are a few key ideas to think about when dealing with ethical scenarios. And one is that if you were to make this decision as a doctor or a medical student in this scenario, would you be able to defend this decision in court? Also, with any ethical scenario, the patient should be fully informed as well as have capacity and competence before making any decision about their treatment. So the 4 pillars of medical ethics are autonomy, beneficence, non-maleficence, and justice. And today's video, I'll be looking at beneficence and non-maleficence specifically. And please check out my other videos on autonomy and capacity and competence. So what is beneficence? So beneficence is the act of doing good for the patient and acting in their best interests. Other than clinical presentation, there should be no other factor that affects your judgment on the care a patient receives. Beneficence involves balancing the risks of treatment with their associated benefits in order to act in the best interest of your patient. And the best interests of a patient vary between patients because each patient is unique. For example, hypothetically, you could be treating a patient A, who's more concerned about being free from pain rather than necessarily living longer. It would be more in patient A's best interest, to provide them with pain-relieving medication, even if that said medication could shorten their life, provided that, again, patient A was fully informed, competent, and had capacity. But say, for example, you were dealing with another patient B, and they were more concerned with staying alive for as long as possible rather than being free from pain. It would be then in patient B's best interest to not use this pain-relieving medication and instead look at alternative treatment which would reduce pain but not reduce their life expectancy as well. It is important to be aware with any ethical or legal scenario, each decision is situation specific. So basically consider the situation independent from others on a case-by-case basis. You can also see from this example how beneficence is almost like an extension of autonomy. And if you want more about autonomy, please check out my other video. So non-maleficence, this is the 3rd pillar of medical ethics, and this essentially means to do no harm to the patient. It's similar to beneficence, that you should not act in a way which would harm the patient. Any good assessment of beneficence should be looking at the infringements of non-maleficence as well. So let's continue with this previous example of pain-relieving medication. Yes, it may provide pain relief to the patient, but it doesn't necessarily make the patient better clinically. In fact, it shortens their life. So this would clearly do harm to the patient. However, you could argue that if you do not provide this pain-relieving medication, you could be causing harm to the patient by going against their wishes and damaging the doctor-patient relationship. So yeah, thank you very much for watching this video, and please keep an eye out for the next videos in this series. Please like, share, and subscribe to the channel, and please follow the Inside Scan on Twitter and Instagram. Thanks very much for watching, and best of luck with the application.